I'm Felicia McIntosh, and I know a lot of you known a lot of you for a very long time. And so for those of you that have known me for a long time, you know that I used to always call him my Mike, but now he's my husband, ergo the name changed to Felicia McIntosh, which really threw everybody. So he was kind of passionate about the name McIntosh because Phillips was my ex-husband's last name. So I don't know, men, you know, have your fragile egos. So I'm trying to be funny to keep from getting kind of what?
I said stop while you were
Oh
on.
no. So I'm trying to be funny to keep from getting choked up about this because this is kind of an emotional topic for me. So Ed used to be my Mike, and now my husband. He's also the love of my life, and I came really close to losing him in December 2013. So we're really thankful that he's here, and I hope he can inspire you and maybe help you kind of, you know, turn over a new leaf if that's what you need to do. And I know there's some of us, you know, the Selectman brothers, not to point out anybody, they've been through some of this too. So anyway, so I'm really thrilled that you're here, and thank you for inviting me too. And I'll sit down and be quiet now. Maybe.
Thank you. I would say she inspires me every day too. So it's great to be here. I had my bypass surgery in 2013, December, and I've actually given this presentation a number of times, and people seem to like it, and they keep asking me to come back and talk about it. So I might just ask, I know we do have some folks in the house that have had open heart surgery, bypass surgery, so I'd just be curious, any of you others? What about stents or angioplasty? Okay. What about family members that have had bypass surgery? Okay. So see, there's this pretty interesting discussion that we can have here because it does affect a lot of folks, and I'll just kind of start off with just a few statistics that kind of emphasize that. We do about 500,000 of these a year here in the United States. Now there's more if you kind of include stents and angioplasty. There's even more than that. So that's a pretty large number. And I will say here at the very beginning, I'm not a physician, but I do have some strong opinions about some of the things that we're currently doing today relative to coronary artery disease. So don't change anything you're doing based on what I say. But this is a pretty disturbing statistic that about sudden death is really the first sign for a cardiovascular disease for about 50% of the individuals that have coronary artery disease. That's an impressive statistic right there. And 50% of the heart attack patients have normal LDL levels. And what's LDL? Cholesterol, right. And so you have kind of two that we always talk about, which is the HDL and the LDL. HDL kind of gets that good cholesterol notation, and LDL is what we call bad cholesterol. And in reality, we could not live without LDL. LDL really is a life-saving kind of cholesterol that we cannot do without. But when you kind of couple these two together, it kind of makes you wonder, are we really looking for the right things in individuals to determine whether or not they are at risk for cardiovascular disease? This is a strong question, I think, and one we'll talk about just a little bit from my perspective. So, coronary artery bypass graft, CABG. I always thought that was an interesting term, medical term for what they did to me, but that's the term. And it typically will be, when you see it on the medical information, it will be CABG times 2 or 3 or 4 or 5, and that's the number of bypasses that they actually had to do. But it is a grafting sort of process. And so basically, what happens is they kind of open up your chest wide open. They stop your heart and put it on a bypass machine to where your tissues are all still getting blood flow. But the interesting thing for me was that stopping the heart was something that I remember kind of fretting over a little bit the night before the surgery. We had to be at the hospital at about 5:30 in the morning, and so the night before was kind of a hard night to get to sleep. And I kept, one thought that I kept having was that my heart had been beating for every moment of every day for the past 63 years at that time. And tomorrow they're going to stop it. And I think I really kind of worried about that. When I think back about the things that worried me the most, that was one of them that worried me the most. And it turned out that actually that's a pretty easy thing for your heart to get started back again. Once it gets all the blood flow returning back to it, it starts back, and it doesn't even have to be shocked or anything like that. It's pretty common for that to just start beating right again. So no problems there. So what is all this grafting and stuff that they're doing, the bypassing? So you have these major arteries kind of that surround the heart to get blood flow to the heart. And so when you have blockage, generally it's the plaque that's causing the blockage, and generally it's what we call the hard plaque. There is also soft plaque, which is kind of has a tendency to sort of break away, and those can actually cause blood clots. If that gets to the brain, you can have a clot in the brain, you can have clots any other place. But it's typically the hard plaque that's really kind of giving the problems here, because that's what's restricting the arteries. And so we're sort of blessed with some extra parts, if you will. And so in this particular case, on this one here, we have a mammary artery that kind of goes across the chest here, and they can actually pull that down and reattach it below the blockage, and that's one of the bypasses. Then typically they harvest a vein out of your leg. It's called the saphenous vein, which is an extra vein, and they harvest that out of the leg for these other bypasses. And so you can have any number of bypasses depending on where the blockage is. I had 4 bypasses. I was diagnosed with 3, but apparently once they got in there, the cardiac surgeon was feeling around the back side of the heart, and one of the arteries back there felt sort of different to him, and he got my cardiologist on the phone, and I can only imagine what this is like. I'm laying there with my chest wide open, and he's got the cardiologist on the phone saying, "Hey, I think we may have a 4th one here. What do you think? Should we go ahead and do a bypass?" "Yeah, let's do it." And then off the phone, and they do the 4th one. Most of the time, people used to have a lot of problems with this harvesting the vein out of the leg. You may remember, or you've heard of folks that they have more trouble out of that because they used to just kind of open you up all the way down from your groin to your ankle, just about. A lot of problems with that. Now, I mean, I have 2 little incisions, one just above the knee and one down below, and you can hardly even see those anymore. And they have a special tool that was actually developed here in Knoxville for actually harvesting that vein, and it's less traumatic to the leg. Then, of course, they have to stitch those together. In this one, it's artery to artery, and the others, typically, it's vein to artery. And the arteries themselves are actually a lot more robust and a lot stronger than the veins are. But typically, that doesn't cause a problem for many people, although I've heard, and I'm not sure. So we have an example where it didn't go so well and had to be redone. But typically, it goes pretty well, but it is pretty small incisions there, micro incisions to actually link those together. Then they close you back up, and I'm not sure if you can see it very well here, but when they pull the rib cage back together, they have to wire you shut. So what you see here in those little shadows here is the wire that goes in there. Occasionally, you'll have those break, and they'll kind of pop out, and people will have problems with those sometimes. And then you have a month, maybe 2 months of cardiac rehab. I will tell you that I was actually in pretty good shape before this. I actually exercised quite a bit, thought I was eating pretty well, and I thought I was really in pretty good shape. So this was really an eye-opening experience for me. I did not actually have a heart attack, which was really good for me, because that means I don't have any heart muscle damage. A lot of people that go back through cardiac rehab have more problem with that, to get their heart, really kind of back online to being closer to normal. So you go through all of that, and the cardiac rehab until you get released and can come back to work. So I kind of tell you about all of that to give you kind of an interesting statistic, another statistic that I thought was interesting, and I really got into reading a lot about what was going on, what I needed to do to change my lifestyle, eating habits, and all that kind of stuff. And ran across this book called Change or Die. And in it was a quote from Dr. Edward Miller from the Johns Hopkins University. And he said that statistically, that within 2 years following bypass surgery, 90% of the patients have reverted back to their old habits. 90%. That was an amazing statistic to me. Why do you think that is? Why do you think that within 2 years, we just kind of drift back into our old habit patterns?
Do you think they think that it took me 60 years to get here? You know, another 60 years to get me, or 40 years?
Could be, could be. I think part of it too is maybe that we've become a society of sort of instant gratification. You know, give me a pill, you know, I went through this, I'm probably gonna coast for another 8, 9, 10 years before I might have to have this again. And we're willing to go through this again rather than make the change. Because this is what they were telling their patients. If you don't change, you're gonna die. And what they actually found later on was that when they changed that message to have them really looking forward to those things that brought joy in their life, that they were much more successful in making that change. So it wasn't so much about focusing on the dread as it was focusing on what makes you happy. You know? And it made a terrific change in the success rate of those. So here's a question that I get a lot. Is how did you know? Because like I said, I did not have a heart attack. So how did you know that you had blockage or cardiovascular disease? So I was having some discussion with my doctor. And I have a great family physician, and we had lots of spirited sort of discussions because I have some pretty strong opinions, and some of them kind of go against the traditional medical ideas. So anyway, I have a pretty good background in physiology, and so I was just noticing, hadn't been noticing for some time, that my stamina just seemed like it wasn't really very good. I exercised a lot. It seemed like every time I would, every time I get back to exercising, it's like I was starting all over again. So we were having this sort of discussion, and he said, maybe what we should do, because I was actually already on statins and had been for some time, so my cholesterol levels were in control based on the statin medication. He said, why don't we consider a coronary calcium scan? Now, this is a kind of a non-invasive CT type scan. It does kind of the thoracic area and the abdomen area. And my insurance didn't cover that. It typically doesn't, but it was only about $100, and I had it done over at the UT Medical in Turkey Creek. It only took a few minutes. And right after that test, I happened to be fortunate enough that the cardiologist was there, and so they asked me if I'd like to speak to him, and so I did. And he told me that it looked like to him that I had about 90% blockage in 3 of the main arteries. And I really was having trouble processing that, because 90% seems like a lot of blockage, doesn't it? And you really have to have blood flowing to the heart in order to kind of sustain life. And the one thing that I did learn from that discussion was that you may actually do well if you're a very active, athletic kind of person, because the heart is somewhat accommodating, because it builds what it calls collateral blood flow. So if you're putting demand on it quite a bit, then it'll actually find a way to create enough blood flow to keep the heart sustained. Now, you can rock along like that for a while until maybe you overexert somehow and you end up having a heart attack. But I thought that was kind of interesting, that how the body accommodates for that. So from that point, I went to a cardiologist, and he prescribed had to do an echocardiogram, which went through that. That actually confirmed the first test, and then after that, we did the heart catheterization, which is kind of the gold standard. And generally, insurance companies don't go down that bypass path unless you get through this and they confirm it. He only was in there for a few moments, and he came out and said, it looks like we got three arteries that are totally blocked, or 90% blocked, 95% blocked. And so when I came to after that, the cardiac surgeon was standing over me, and Dr. Pollard was his name, and he is wonderful. Anybody has any interest in that after this? Wonderful cardiac surgeon. And so he had seen the test results, and he said, Mr. McIntosh, he said, I've seen the results. He said, based on what I'm seeing, I would predict that you have about let's see, within 6 to 9 months, you're likely to have a fatal heart attack. And he said, we have an opening on Tuesday, I think this was like Wednesday or Thursday, for bypass surgery if you would like to do that. And I said, I didn't even have to think about it. I said, no, let's absolutely do that. And then as I mentioned, once they got in there, they found there was a 4th artery that was blocked on the backside, so it ended up being 4. And of course, the surgery itself, which is not that much fun. So
it was really hard this time for me.
Yes,
I
yes.
slept at the foot of the bed for a
Yeah.
week, so it was all about me.
I thought it was about me, but it really wasn't. So here's a little different twist on this whole thing, because we have so much focus on cholesterol. And so I have what is called an Lp(a) pattern type. Now, about 20% of the population fall into that category. And it's a very, well, we don't have time to get into the details of that, but it goes back way, way, way back. And a lot of people feel like it's kind of the survival capability. That's how we survived a lot of things. But since we don't have to get out and hunt for our food and do a lot of that kind of stuff, we don't need it as much. So anyway, the Lp(a) is like an LDL particle, except it's smaller, denser, and has this little tail on the end of it, and it's very sticky. And folks that have that pattern type, what happens is, because it's very sticky, it tends to stick to the walls of the arteries. And when it sticks to the walls, your LDL, which is carrying the LDL cholesterol, is actually there to repair that inflammation site. And so when that happens, it's like if you get a cut on your skin and it starts to scab over, you know, it starts to take up room. So you have lots of that stuff, so you get a lot more blockage, and pretty soon you have restrictive blood flow through those arteries. So it is an LDL particle, like, not LDL, but like it, with this tail on the end of it. And high levels are associated with increased risk of cardiovascular disease and stroke. But how many of you know what your Lp(a) levels are? No, because it's not part of the traditional 4-panel test that we do for cholesterol. We look at total cholesterol, HDL, LDL, and triglycerides. And by the way, LDL is actually a calculated value. It's not a measured value. And so this tells us, the studies now are telling us, and have been telling us for quite some time, that individuals, about 1 in 5 individuals have Lp(a) plasma levels above 50. About 1 in 4 have them above 32, and levels less than 30 are considered normal. So you could have this pattern type and never know it. And I didn't know it until we actually started doing this testing in order to see it. The other part of it is that none of the available cholesterol-lowering drugs have any impact on it at all, and diet and exercise have limited impact on it. So you're sort of out there in no man's land in a way. So it's taken a lot of research on my part to figure out what is it that I can do to help eliminate, reduce that or eliminate that. So that is a significant risk factor. So, what tests are available to assess your risk? Well, this test that really does the best job is this advanced cardiovascular diagnostics. It's looking at the Lp(a) particles, all your lipoprotein particles. It's not just looking at the particles, it's looking at the size and the number of them. And we don't get that either in our traditional sampling of cholesterol. We don't know how many particles there actually are, and we don't know what the size of those are. And we'll talk about why that's relevant here in just a moment. It talks about inflammation. A lot of people feel like that it's not about cholesterol, it's about inflammation in the body that causes cardiovascular disease. Heart function, genetics. were kind of jokingly about good genes, bad genes. That's really pretty true. There's a book, and I'll talk about it at the end there, called the ApoE gene diet. And the ApoE gene actually can predict whether or not you do better on a high carb diet, high fat diet, or both, or how you do relative to exercise. Do you respond better to aerobic exercise or better to strength building exercises, or a combination of the two? So knowing that also helps you recover or even prevent cardiovascular disease. Omega-3s. There are a lot of countries and cultures who eat a lot of fish, and they really don't have very much cardiovascular disease in their whole culture because of that. So the omega-3 index will actually help determine whether you're at an optimal point for that. Then lots of other factors. So you might consider requesting that at your physician. Don't be surprised if they don't know what it is. So you may have to go prepared to have this kind of discussion with them and see what your options might be. Here are some of the labs that actually do them. The other thing you can kind of do is kind of look at your family history. You really don't have to look very far beyond your parents and your grandparents to see what you're at risk for. That's a really good place to start. So if you're seeing that in your family, cardiovascular disease, stroke, those kinds of things, that's a really good place to start to determine if you're maybe at risk, for the same thing. What can you do? Like I said, if you have a family history of heart disease or stroke, try to find out if there's a way for you to get at least the expanded lipid panel results to kind of see what your risk might actually look like. Consider getting that coronary calcium score done. Like I said, I can also tell you that's almost overwhelming, and you will get things that are contradictory too, that you sort of have to come to your own decision about whether you think this is right or not. Just a couple of books. I will tell you just from a nutrition perspective, I was about 185 pounds before the surgery, and I'm at about 155 now. I'd like to be at about 153. But one of the dramatic things, I read this book called the Wheat Belly book by Dr. Davis, and from that book, I eliminated sugar, all grains, pastas, bread, things like that. It was amazing how quickly the weight came off. So there's a lot there. Pasta and when I've done this in the past, we have end up with a lot of discussion about bread, because they will refer back to the Bible. You have to realize that bread from the Bible is a lot different than the bread we have today. The grains and things that breads are made from today are treated with pesticides. They're genetically modified in a lot of cases to prevent crop disease and other things like that. Our bodies, evolutionary-wise, have not kept up with the changes that are coming in a lot of our food stocks. Another controversial thing here is about thyroid. This is such a big topic, and a lot of controversy out there about synthetic thyroid medications versus natural desiccated ones. But you need to pay attention to your thyroid. It controls so many of your systems in your body. It's insane what it actually controls. But it can be out of whack. You'll see signs of dry skin, hair thinning, hair falling out, being really tired, just not feeling like exercising. A lot of that is controlled by your thyroid. And so make sure you understand how that works and what you need to do to address your thyroid. You could have a hyperactive thyroid or a hypoactive thyroid. One is underactive, one's overactive. This is a good book, really good book, called Stop the Thyroid Madness. So if you have any concerns about your thyroid, I would suggest you take a look at that. The other thing you can do, and I know I'm kind of running through this pretty quickly, but is get your diet in check. Tennessee now has the 14th highest adult obesity rate in the nation, and this is 2014 data. The adult obesity rate is currently 31% in Tennessee. That's up from about 21% in 2000 and up from about 11% in 1990. Look at what's happening here. What do you think this is happening? Why do you think obesity rates are going like this? This is insane. Why do you think that is?
Chick-fil-A.
It's what?
It's mostly Chick-fil-A.
Okay. All of those things are contributors. Fast food, high fructose corn syrup, sugar, hidden sugars. Hidden sugars in a lot of our food. Breads. If you think back, any of you remember the food pyramid? If you go back to the early days of the food pyramid, what you saw predominantly at the base, it was a large portion of the diet, was grains. Breads, breads, even whole wheat bread, which is advertised basically as a really healthy option because it has a lot of fiber. Folks, bread metabolizes in the body just like sugar. So it's like having a teaspoon of sugar with every slice of bread you've got. So we've changed that over the years. As a matter of fact, when it was originally put out there, the food pyramid, the Department of Agriculture actually took issue with it because there wasn't enough grains on it. And they actually forced it to be more grains per portion. And so that's driven a lot of our dietary training and teaching over the years and kind of driven us down this path of what's healthy. For years, how many of you have probably even been on a low-fat diet? Because we were told low fat. We want to cut fat out of the diet. That somehow fats, make us fat. Cholesterol, low cholesterol diets. There is research out there that says dietary cholesterol has nothing to do with blood serum cholesterol. So we've been eliminating stuff out of our diet that actually could have helped us. For men, low testosterone levels directly related to the low-fat diets that we've been in for years and years and years. I mean, you're starting to see these, there's a low T center over in Knoxville. I mean, these places are showing up because what we've been prescribing over the past many years has turned out to be wrong or based on poor data. And so we've been going down this path thinking we're doing the right thing when we really haven't. So it just kind of reinforces you kind of have to question those things a little bit. Obesity-related health issues, diabetes, hypertension, stroke, heart disease, osteoarthritis, obesity-related cancers like colon, breast, endometrial, and gallbladder cancers. So get your diet in check, and it will pay back great dividends. As a matter of fact, if you get the more fit and healthy you are, if you have to have any kind of surgery, research now shows that you'll recover much faster from that if you're healthier and exercise and in shape. And I actually found that to be the case from during my rehab. They actually got back with my cardiologist to get them to approve me going up levels faster than most people were that had been through bypass surgery because I was actually in pretty good shape to begin with. So here's some just basic lab results you should pay attention to. The LP(a), LDL particle number, if you can get that information, they say this is a pretty strong predictor of cardiac risk. The LDL particle size, generally larger and fluffier, are better because they don't tend to impact the arterial wall and embed in it, and where you got this scarring or repair thing going on. The LP(a), we talked about that a little bit. There's actually pretty good indicators now that the triglyceride HDL ratio is a pretty good predictor. So if you can look at your results right now and do this, and if it's 4 or higher, then you need to be you're considered at risk for cardiovascular disease. C-reactive protein, that's typically something we'll see every once in a while. It's usually expressed this way on your medical results, but elevated levels have been shown to be strong indicators of cardiovascular disease. Homocysteine levels are very injurious to the blood cell walls, and vitamin D deficiency. We don't think about this too much, but since we've been putting on a lot of sunscreen, we don't get as much vitamin D from the sun anymore. And so it makes a good case for supplementation. Supplementing, taking a supplement for vitamin D, it actually helps to reduce weight also. It's not just about how much cholesterol you have. It's all these other risk factors that are associated with it. That's these are some books, and I think you've got the presentation, so if you want to make it available, that's fine. These are just a few of the books that are out there that I've really got a lot of good information out of. And the last thing that I would kind of leave you with is that, from my perspective, going through all of this, I started to form my own sort of philosophy in life. And that is that our lives are a continual series of lessons and defining moments that teach us about life, but only if we're willing to listen, take action, and embrace each day as a precious gift for us and the day and those around us. And I'll give you one quick example of a defining moment for me. Right before the surgery, they asked the family members if they want to come in and spend a little bit of time with you before they wheel you off and do all this stuff to you. And I can remember, the thing that I remember the most, the defining moment for me, was looking at Felicia's face, seeing the concern that she had that this could be, in her mind at least, the last time that she would see me, that I might not make it through this. And it was that actually inspires me every day to try to do better. Because you see, it's not just about you. It's about everybody that cares about you, that depends on you, that loves you, and you're there for them. So when you make those decisions, those poor health decisions, think about that. A lot of times we think that, well, I can do this. It's just affecting me. That's not true. It affects everybody around you, especially those people that care about you.